Good afternoon and welcome. My name is John Pilot. I'm the Assistant Director of Lifetime Learning at the University of Virginia's Office of Engagement. I want to extend a warm welcome to all of our viewers. I'm so pleased that you're joining us this afternoon for our program today, Aging Well: Challenges and Innovations in Caregiving. Please note, this program is being recorded and will be posted in Lifetime Learning's vodcast library in a week or so. We received many questions in advance of the program that have been shared with our speakers. If you have a question during the presentation, you may enter it in the Q&A box at the bottom of your screen. Now, I'll introduce our two faculty speakers. Dr. Ishan Williams is a tenured professor at the University of Virginia School of Nursing. Her background and PhD are in human development and family studies. As a social and behavioral scientist, Dr. Williams' research concentrates on using an ethically grounded approach aimed at advancing understanding of the needs of older adults living with Alzheimer's disease and related dementias, as well as their care partners. Dr. Carol Manning is the director of the Memory Disorders Clinic, co-director of the Virginia Alzheimer's Disease Center, Harrison Distinguished Teaching Professor of Neurology, director of the Neurobehavioral Assessment Laboratory, and associate chair for faculty development at the Department of Neurology at the University of Virginia. Manning is a board-certified neuropsychologist. Her clinical interests include diagnostic issues in dementia, cognitive and behavioral changes associated with dementia, and the well-being of caregivers. Thank you for joining us. Drs. Williams and Manning, I invite you to begin your presentation today.
Okay. Hello, everyone. Thank you so much for joining us today. We are going to talk about caregiving for people with dementia and aging and wellness. And to start that, I want to just talk about a little bit about Alzheimer's disease, which really is an epidemic. There are over 7 million Americans who are currently living with the disease, and this number is increasing dramatically. In 2025, it cost about $384 billion to care for those people, and this is going to rise to about $1 trillion. 1 in 3 people over age 65 dies with Alzheimer's disease or another type of dementia, and Alzheimer's is just the most common dementia. And who provides care for them? Some of us are people who work in memory disorders clinics, but most of them are people who are unpaid caregivers who are family members or friends. There are nearly 12 million of them. Next slide, please. So while early intervention is key and ultimately curing the disease before it begins is what we need to do, ultimately today, next slide, please. It's caregivers who are unpaid caregivers who are taking care of people with the disease. And they are the forgotten sufferers of Alzheimer's disease because they live with the disease every day, just like the person with dementia. But it's important to note that caregivers of people with dementia are at increased risk for dementia themselves. They're 6 times more likely to develop Alzheimer's disease than non-caregivers. The great majority, that is about 72% of them, say that their health has worsened since they've become caregivers. They experience high rates of depression. They miss their own doctor's appointments, so they're not taking care of their own health. And a much larger percent of them have been hospitalized for their own health since becoming a caregiver than people who are not caregivers but that are the same age. What's important? We need to figure out how we can care for caregivers given the increased mortality, and we need to treat the threats to caregiving that include brain and heart health, things like high blood pressure, diabetes, depression, anxiety, sleep disorders, fall prevention, as well as provide general health improvements, with a healthy lifestyle, more preventive care, and making time for caregivers themselves and their healthcare needs. And we're going to today talk more about how you can care for, whether you're a caregiver or not, how you can care for your brain and increase the chances that you are going to age well and become a healthy ager as opposed to someone with dementia.
Okay, thanks so much, Carol, for that introduction. As Carol suggested, we're going to talk about just how all of us can take care of our brain. So, we're going to talk about physical activity. I'm sure that's not new to many of you in our audience about how we need to stay active. We're going to talk a little bit more about diet and your nutrition. Then, we're going to shift to cognitive activity and talk about social activity and how all four of these areas are hugely important to just taking care of your brain. I know many may have heard what's good for your heart is good for your brain. So you'll hear a lot of similarities if that's something you've been thinking about already. And a lot of this information may come off as very overwhelming, but we just want you to think about what's one thing that I might be able to change, which one thing that I can take control over today for one day that I might be able to increase my physical activity or do something different that I haven't tried yet. Again, all thinking about how we all can age well. And I'll talk a little bit more about physical activity first. So, high physical activity is known to be associated with at least 40% reduction of cognitive decline. Physical activity is known to be a protective factor. So that's why we talk a lot about how can we become active? What are some things that we can do to help our bodies to move either moderately or more vigorously? And to date, there's really about 30 minutes of exercise or physical activity that we're encouraging people to do, which is about 150 minutes of activity a week, is all known to have some benefit to each of us as we age. What can we do in terms of physical activity? So I'm trying to be careful about how I say it because I know what I do for physical activity, but maybe there are other things that you can think about how you can move your body and how you can get more active. But here's some strategies we've listed here. We can walk, you can run, you can dance, you can do yoga, you can lift weights, you can swim. You also can do things like walking your dog. Like, don't minimize the opportunities you have to go outside and walk your dog. Taking the stairs when you can. Don't park in the closest space when you go to the grocery store. These small changes, even mowing the lawn or cleaning the house, I don't have it on the slide, but gardening is a big thing as we're hoping to get some more spring in the Virginia area soon. These are some things that, again, you may not think about in terms of physical activity, but any way you can encourage, bringing some of these activities into your daily life will also increase your activity level over time. So now we're thinking about moving to diet and exercise. What to eat? What are the things that we want to increase in our diet? Again, as I talk through food, food is it's a cultural thing. It's very sensitive. People don't like to talk about their diet and don't ever want to have someone tell them what to eat and what not to eat. I'm in that camp. So it's really what I found to be helpful for me is to think about things that I can increase in my daily diet and not always talking about deficit or things that I can't have. Now, I will have a slide that talks about things that we need to reduce, but let's talk about how we can just increase some of these areas. For instance, nuts, seeds, legumes, beans, whole grain, lean meats and fish, fruits and vegetables, of course, and again, olive oil. And these have all been shown as really positive, again, nutritional benefits that we can have for your brain as we age. As I said, what comes with the increase, you always have things that you have to think about and consider. And remember, we're talking about things in moderation, so not cutting things completely out of your diet if that's really hard for you to do. What you can do is think about small changes and how to reduce things like saturated or trans fat, any types of processed foods. I've always I tell myself things that are closest to the ground I want to eat more of, right? So things that haven't been processed, that I can just eat right away, those are things that we want to increase in our diet. Foods that are high in sodium and sugar, we want to reduce those things. Again, I'm not saying you can't have those things, but we want to reduce those and increase those fruits and vegetables. Deep fried foods and unhealthy fast foods. Again, these are things that, again, we're not total elimination. We're just thinking about what are some things that we can potentially reduce in our diet to continue to help us build that brain health and increase over time as we age. So this is areas in the Mediterranean diet that has been shown with research to support all of the diet and nutrition benefits that we just talked about. Again, eating vegetables, fruits, legumes, nuts, fish, and limiting the amount of red meat that we eat. And then many of you may have heard of the DASH diet. The DASH diet stands for Dietary Approaches to Stop Hypertension, or DASH, which is recommended to treat or prevent hypertension and reduce the risk of heart disease. This has been out and well known in at least in practice and treatment, and lots of people know about it, but it does focus, if you'll see the similarities here, on fruits, vegetables, whole grains, and lean meats. Now, researchers have noticed that high blood pressure was much less common in people who have had that plant-based diet. Those include vegans and vegetarians. So again, we're emphasizing the focus on increasing fruits and vegetables with lean protein sources like chicken, fish, or beans, and having little red meat, salt, and added sugars or fat. So this is another just description of the MIND diet. So this is a combination of the DASH diet and the Mediterranean diets that I previously talked about. This diet is aimed at reducing the risk of dementia and the decline in brain health that people often experience as they age. So again, you'll see some similarities here. We talk about, like there's salmon mentioned, about very low in saturated fats, and it's a good source of protein. It's also one of the best sources of vitamin B12. Fish is high in omega-3s. So thinking about ways that you can increase those is where the MIND diet is really helping you to focus. So again, here's some additional examples of why the MIND diet is what they're promoting in terms of green leafy vegetables. We're wanting you to aim for 6 or more servings per week. I mean, these can be things like kale, spinach, cooked greens, and salads. But again, all other vegetables, if you can think about that one additional thing that you can do, maybe it's just increasing one vegetable that day. But again, it is better to choose non-starchy vegetables because they provide a lot of nutrients for a low number of calories. Berries at least twice a week. Berries such as strawberries, blueberries, raspberries, and blackberries all have very good antioxidant benefits. And then nuts, which is you encourage the diet suggests 5 or more servings of nuts per week. They don't necessarily specify the kind of nuts to consume, but it is probably best to vary the type of nuts that you eat to obtain a variety of nutrients. And then we have olive oil, whole grains, other beans, and fish, as I've already mentioned. Poultry, eating chicken or turkey at least twice a week. And note that fried chicken is not encouraged on the MIND diet, although we all love it. So these are just some suggestions of if you're thinking about small changes that you can potentially do to your diet to help increase your brain health. So does it really work? I know if my doctor tells me it works, she really wants me to try this diet all the time. So it's something that I'm actively trying to focus on. But there has been also research to support this more recently too, to suggest that both the Mind diet and Mediterranean diets are associated with less Alzheimer's disease pathology, primarily the beta amyloid load, where they also saw in the study done at Rush Memory and Aging Project that higher green leafy vegetables were associated with less AD pathology as well. So again, we've heard about these diets before, but I just wanted to highlight that they're still finding some good evidence that these diets do help promote brain health. So Carol?
Okay, thank you. And a new study just came out comparing people on the older people comparing the Mind diet relative to a regular diet, and they found that the Mind diet actually helped maintain gray matter in the brain. So there are actual brain changes that are, or fewer brain changes that are associated with being on the Mind diet. So let's talk about cognitive activity. Cognitive activity is really important. Being cognitively active actually has a protective effect on cardiovascular and pulmonary systems. And you've probably heard use it or lose it, which is correct. It is really important to maintain cognitive activity. I just saw a new study that came out that looked at the amount of cognitive activity that people participate in after retirement. And there is a tendency for people after retiring to have lower cognitive activity. But among those people who made efforts to maintain cognitive activity, they also maintained better cognitive abilities. And people often ask, what kind of cognitive activities should you participate in? And that really is a question I get a lot is, do I need to do crossword puzzles? And my response to that is do what you enjoy, because if you don't enjoy it, you're not going to actually continue with it. So lighter intensity and more enjoyable activities tend to have better adherence. So it doesn't really matter what it is. I'm going to talk about, on the next slide, I'm going to talk about some new evidence that suggests that there actually is some training that has been proven to be helpful. Prior to this study coming out, that came out recently, it's called the ACTIVE trial. Prior to that, I would have told you that when you do the cognitive, a lot of the things that you hear about or you read about in terms of cognitive programs that you can do on the internet or on your phone, most of the evidence for those programs shows that you get better at those particular tasks, but you don't get better at cognitive abilities in general. Until this trial came out, the ACTIVE trial recently. And as you can see here, it's the largest cognitive training randomized controlled trial. That means it was random whether you were in the intervention or you were in the control arm. There were 2,800 adults who were either 65 or older, and they had 10 and 20-year follow-ups. And in this study, people did either memory training, reasoning training, or speed of processing training. And interestingly, what they just found out is that over the long haul, people who were in the speed of processing training had the most durable and longest term events, even up to 20 years later. And they also found that there was a lower dementia risk, 25 to 30%, which is huge among those who did booster sessions after the initial training. And there is a company that now actually, the original researchers have this program out that you can get that actually is evidence-based. So my response today is different than it would have been a couple of months ago. Next slide, please. Social activity is also incredibly important. It provides mental stimulation. So there's a thin line between cognitive and social activity. It's social activity is associated with better overall health, and it's associated with more social support and more connectedness. And lower social support, conversely, is associated with a higher risk of cognitive impairment. And so you might say, well, people who are lonely seek out less cognitive activity. But even when they look at studies where they manipulate the social support, the risk of cognitive impairment is better among those who have the higher social support. So next slide, please. And social activity can be really varied. It can, as long as it involves other people, it's important that it's enjoyable. It can be planned or spontaneous. It can be formal or informal. So it really doesn't matter. We've talked about a lot of things. What works? What are the lifestyle interventions that work? And what we can see from the research is that multi-domain lifestyle interventions are the most successful in terms of maintaining cognitive health. And what I mean by that is, of the things that we've talked about, any combination of them is better than any one of them alone. So cognitive training plus aerobic exercise, cognitive training and social engagement, or best of all, use cognitive training, diet, social engagement, and aerobic exercise. And there is actually very good evidence that aerobic exercise, so that exercise getting your heart rate up, is really good for maintaining your cognitive abilities. A couple other things that I want to make sure we mention. We already talked about the aerobic exercise and diet. Vascular risk control is really important. There's more and more data showing that hearing correction is incredibly important for maintaining cognitive abilities. So we know that people who can't hear are at greater risk for dementia, and that actually using hearing aids prevents the dementia or prevents an increase in cognitive disability. Cognitively stimulating activities and social engagement, as we've talked about. So all of these together.
All right. Thanks so much, Carol. And again, I think those are such good strategies, and we'll have some time at the end to focus on giving some more examples of what some of those studies showed as activities that would be helpful. But I wanted to shift just a little bit. Some of the work that I do is often in community-based settings. And many of our communities, some people face these additional extra barriers to not only taking care of themselves, but taking care of the loved one that may be experiencing or living with dementia, especially those who are African American or underserved populations, like those who live in rural areas and those who don't have proper or good insurance. So these groups often have higher rates of dementia and unfortunately higher death rates from it. One reason is that access to care can be limited, and sometimes there's hesitation to even see a doctor because of past experiences or trust concerns. So as a result, many people are just not getting diagnosed until the disease has progressed much further in the disease progression, missing that chance to treat other health problems like high blood pressure, as we've talked about. And if you treat these chronic conditions, or diabetes, that can make, if you don't treat those, that can make your dementia even worse. That's why I think it's really important that we focus a lot on education and advocacy, and knowing the signs, and asking questions and speaking up for yourself or your loved one can make a huge difference in getting earlier care and better support. So I'm going to share a little bit about, if you are, say, worried or concerned about someone that you love or someone you know that could be suffering from memory loss. Here's some information that, if you are accompanying the person to the doctor or healthcare provider, that you want to make sure you have at the ready, so that, again, the earlier you can get into treatment and to talk about your concerns, the more options will be available for how to manage the progression over time. So here's information to have at the ready. Think about approximately when the memory or thinking problems started, whether there are changes in the person's mood or behaviors, how the problems have been changing over time, and then potentially write down some concrete examples of what was noticed. The more examples, the better. For example, I just listed one here. Previous executive chef burns 3 entrees when preparing a Thanksgiving dinner. That is hugely uncommon or is something you haven't seen. So those are concrete examples that you can share with the healthcare provider if you have concerns. Also, thinking about one's education or their occupational history, what is their normal baseline is going to be a key question in a dementia evaluation. Also, their medical history, as much information as you can have about their medical history will be really important. And that includes any like stroke, whether they have sleep apnea or other sleep quality issues, any thyroid issues, or substance abuse or any other mental health concerns. These are all good markers to actually be able to share with the healthcare provider if you have concerns. And then, as we encourage all of us to do when we go to a provider or even our primary care providers, is to have a full and accurate medication list, things that are prescribed and even those things that are over the counter, such as supplements. So, keeping a good, up to date list of those medications is really key. Another thing that I like to talk about in terms of advocating is just to speak up. Know when you have an opportunity to talk to a doctor or a provider, this is a good chance for you to get those concerns mentioned. And often, if you are a care partner or a caregiver, they're not necessarily going to ask you unless you kind of advocate for yourself. But having those items that we just talked about at the ready would be really important. So if you're concerned about a loved one, find a way to share your concerns openly, even if that means sending a private conversation to the provider, whether that's an email, a portal message, handwritten letter to the slip to the doctor. Some of us, in the same system with your doc, you can let other doctors know. So, like, depending on the type of healthcare team you're working with, you might have the ability to talk to more than one provider, and you can use that system as well. And I just wanted to highlight here, and at the end, we'll provide some additional resources, but the Alzheimer's Association has a resource page on how to raise concerns with your friends or loved ones and how to have those conversations with their providers and their doctors as well. So that might be a good resource for many of you or all of us to actually look at and make sure that we understand some of the processes. So, Carol, I'm going to shift back to you as you talk a little bit about some resources at UVA.
Thank you. So I want to talk a little bit about the Memory and Aging Care Clinic, or the Memory Disorders Clinic, as it's also called at UVA. We are at the University of Virginia in Charlottesville, but we serve patients not only from all over Virginia, but from all over the region from many states. And we focus on clinical care, education, and research. If I can have the next slide. I'm going to talk in particular today about our Dementia Care Coordination Program, which is a program that is specifically for caregivers of people with dementia. We've already talked about the problem that is all of these unpaid caregivers who are caring for people with dementia and the difficulties that they experience. So our solution has been to come up with a Dementia Care Coordinator program. Next slide, please. In our program, caregivers are assigned a care coordinator. We do an intake assessment to understand what the issues are, helps our care coordinators understand what the situation is, both with the person with dementia and the caregiver as well. We typically have one in-home visit because it's important to see what the home is like and what the person with dementia and the caregivers are coping with outside of. It's very different when they come into clinic than when they're in their home environment. Our care coordinators do at least monthly check-ins with the caregivers. Those can be by phone, video, Zoom, or in person. So that it's a minimum of once a month, but depending on what's going on with the caregiver and the person living with dementia, those phone calls or those check-ins might be much more frequent. They provide at least 12 months of care or longer if needed, depending on what's going on. Next slide. So I talked about here that at least there is one one home visit. And what do the care coordinators do? They do a whole host of things that you can see here. In general, they help navigate the healthcare system, which can be extremely overwhelming. They provide significant education about the diagnosis, and Alzheimer's is just one kind of dementia, and so the prognosis or what's ahead can vary by the kind of dementia. But even with Alzheimer's, which is the most common dementia, it's really important for both people living with dementia and for their caregivers to understand what's ahead and what's coming. Our care coordinators teach coping skills. They teach non-pharmacological strategies because those are extremely important. They help access community services, so things like the Area Agency on Aging, government resources, senior organizations, adult daycare centers. And they are really important in helping in future planning. So legally, what should be done? What are the financial safeguards? Does the person have power of attorney? We've had occasions where someone has needed durable medical equipment. They needed walkers or changes to the home that they didn't have the resources for, and our care coordinators sometimes work magic and are able to help people get the resources that they need and were unable to otherwise obtain. They also can help with when it is time. A lot of people say that they want to keep their family members at home for the duration, and that's fine. But there are times when that is no longer feasible, and the care coordinators are really helpful at talking through when things have become untenable or when it is in the best health of both the person living with dementia and the caregiver to find a living situation with greater resources. So next slide. Here you can see some testimonials from our care coordinators are absolutely wonderful. They have significant training. We provide them with significant training in dementia and care coordination. And they all have some kind of mental health or dementia care background. So here you just see that how grateful some of our caregivers are to have the support of our care coordinators. And the reason I think it's important to talk about this program is I feel like it is a very helpful and successful program, and our goal is that every person who is caring for someone with dementia should have a care coordinator. This should be something that is available across the United States for every caregiver of someone living with dementia. Next slide. I want to talk just a minute about the Virginia Alzheimer's Disease Registry. That is a registry that we have created here in our clinic at UVA. And what it does is enables us to, when people sign up for our registry, it enables us to call them or contact them whenever we find that there is a clinical trial or a study that might be of interest for either the caregiver, the person with dementia, or we also have healthy people who do not have dementia on our registry as well, so that people can participate in research either that would benefit them personally or benefit people with dementia down the road. We currently have 510 people on the registry, and we provide a quarterly newsletter just to let people know what kind of research opportunities there are. And I have here the UVA CARD lab. That's the Caregiving, Aging, Resilience, and Dementia lab. That is our lab here that studies caregiving and resilience. We do things like try to characterize what care partner needs are, what are interventions that actually work. How can we help with sleep disturbances in care partners? What are the social determinants of care partner health? And how can we study how can we protect cognitive decline in the care partners themselves. You can see our lab members there and contact information as well.
And I think I'm gonna, Carol, we wanted to make sure that we had some time for questions. So I want to make sure that we only have a few more things that I wanted to end with by just saying we've given you a lot of things to think about as you're here because you want to know more about how to age well, but also just taking care of yourself and others that you may be caring for that may be living with dementia. One of the things that I don't think we talk enough about are some things that like related to our own business, like in things that you don't want to forget to ignore. You know, we don't want to ignore these things. And the earlier in the process you have these conversations with your partners, your family members, your friends, people around you, the easier it is for you to focus on some of those other actions that we were encouraging you to do earlier. So one of the things that with this, like this slide suggests, is that we just start the conversations early. Try to think about everyone that is around you who makes decisions or who you would like to be involved in making decisions so that you can start having these conversations when there's not an emergent situation happening. Those are the best times to kind of have these conversations. Also, create documents that communicate what your healthcare wishes are, whether that's around your own medical care, but also financial management and our end of life conversations. This will make sure that your wishes are well documented and known to those who are closest to you. But also, if it needs to be shared with a healthcare provider, you will feel more confident that people know what your wishes are. And I always say this is that we can't just document and make these plans known. We have to regularly visit those plans. And a good time to do that is around a holiday, around a time where you know that you're going to be around people that you love and that you share, you know, a lot of time with. And so, again, thinking about what needs to change every 2 years, every 3 years, like if there are things that we want to update, please review those plans regularly. Pull important papers all together in one place. I have to say, my sister bought us all this big note, this 3-ring binder of all important things that we needed to document and gave it out as Christmas gifts to all of us. So everybody has a 3-ring notebook in their house. And we know that when something's important that we want to document, we just put it in that notebook. So if I go to my mom's house, I know exactly where the notebook is. And I know that even though I'm not living with her, I can go to that notebook and find out what updates or other things that she may have that are important for her. So we don't have to look through any other sort of who knows where my mother would keep things, but we don't have to do that. It's really easily accessible. Also, making copies. Make copies of your healthcare directives, again, so that they are on hand if someone needs them, if there's an emergency. But also that doctors can see that as well. Give permission to people in your life or for a doctor or a lawyer to have the capacity to make decisions for you if that is needed. So you want to think about that and have communications with those around you. And all of these things that we're, sort of raising today all are intended to help reduce anxiety as you age, as you go and you plan ahead. So these are all tools that we think can be really supportive of your as you age well over time. And although we've given you lots of things to think about and some small actions that we hope you might be willing to take for yourself and for your loved ones, there's no one size that fits all. There's no one roadmap. I was talking to someone earlier today and I said, I think it would be nice if there was just like one thing, if someone said, oh, Ishan, do this. And that solved all my problems. We would all do it, right? But we know that there's not one size that fits all. And it really is a long process. And we want you to be able to do the aging process well. And so we want to make sure that we provide some opportunities for you to think through sort of the things that you can do, but also things that can be things that you can do within your family, but also within your community, because this often as we age, it can be a lonely journey. It can be hard and it can be difficult, but there are others out there that can support you in this process. And we want to more, I think, normalize sort of aging, even though that's the one thing we're all doing is aging. But really normalizing these conversations as we age over time will make it a lot easier to reduce the feelings of sadness, the feelings of anger or loneliness. frustration, and even grief as we age. So, again, where do you go? We wanted to offer some additional resources. I think they're going to be placed in the chat for you all to look into. And even given some people may not be who are in the webinar who may not be in Virginia, there are some links that are national links so that you can find some of these local resources within your particular state that you are in. Okay, so Carol, we have made it to the end
We did.
of our formal presentation, and I just want to thank the Lifetime Learning group who has invited us to speak today. And I'm going to open up the Q&A box, Carol, and see if I can start
Okay.
sifting
And
through some of the
I
questions.
have been, while you were talking, Ishan, I looked at some of the questions, so I can start with them
Okay.
while you look. There were several questions on what is speed of processing and what does that look like. Speed of processing is how quickly you can take in information and either use it or remember it. For the active trial that I described, their website is they charge for this, but the associate. So I'm not going to recommend anything that people have to pay for, but it is called Brain HQ. And the tasks that they used for speed of processing is they showed various pictures very quickly on the screen. They flash them on, they disappear, and then you have to remember where those pictures were on the screen. So you have to match them. There were 3 birds, say, that looked the same, and where were they on the screen. So it's how quickly can you take in information and remember it or use it. There were some questions on how does one access the dementia care coordination program. That is for people who are in the memory disorders clinic at UVA. We don't even have enough care coordinators for all of the people who are seen in the memory disorders clinic at UVA. So what we do the best that we can. That is funded through some state funding and some philanthropy. So I wish we could give it to everyone, and we're doing our best. There are other programs across the country that's called the GUIDE program that has a care coordination program that you could look into as well. Someone asked about the PCP made a referral to our clinic yet, and they haven't been contacted yet. Yes, we are doing the best that we can. We are trying to get everybody scheduled as the need is really high, and a limited number of us. So one of the things, more people can get trained in caring for people with dementia. That would be super helpful. But if you don't hear back, have your primary care. It has to be through the referral has to be from a health provider. So have that same health provider contact us again.
Carol, would it be, do you think you could share a little bit about the legislature, like, and how important it is to potentially contact your legislators if you're in Virginia or not?
Right.
Can you talk about a little bit about our ways of which we've been advocating for this at the state level?
Absolutely. And the funding that we have is, I'm very grateful to the Commonwealth of Virginia. What we did is we went and we lobbied and said, we need this. We absolutely, because it is not a service that we can bill for. And we have all these caregivers who are providing the backbone of care for people with dementia. And so by going and speaking to our local legislators, we were able to get them to put some funding in the budget for this program. So it is very important for all of us to let our elected officials know how big a problem dementia is, and how important it is to support our caregivers and make sure that there is funding to help them out with this.
Yeah. And the only thing I'll add to that is that many states, again, thinking about our non-Virginians here, have dementia state plans. And so if you look at potentially your Department of Health and do some sort of just reviewing their websites to kind of identify if they have initiatives already in the space of dementia care, those would be great places to start to have, conversations with your legislatures around improving the care of dementia across the state. I think about Virginia, one of our biggest challenges is in our rural communities because there's so many rural pockets that don't have access to health care. And so these, opportunities to get more funding to train dementia care coordinators across our state is to have the ability to not only be able to support what they're doing in Carol's clinic, but also to build out in our AAA agencies, the area agencies on aging in different counties within our state, so that they also have trained coordinators who have the training and understanding of how to potentially serve families who need the resources. So,
And I think Virginia is actually very forward thinking. We were one of the first states to have a dementia care plan. We have lots of attempts to make this a dementia friendly state.
mhm.
Um, and we have something called the Dementia Roadmap, which we hand out to patients and caregivers all the time, which is really great, and that is online. Someone asked about public access to patient information, the dementia registry. Actually, absolutely not. Individuals' identities and patient information is highly protected, so that is not something that you need to worry about should you choose to become part of our registry.
Carol, one other question said, can you talk a little bit more about vascular dementia?
So vascular dementia is a very common type of dementia that it is often thought to be the second most common type of dementia after Alzheimer's disease. And that is related to cardiovascular risks. So having the risk factors for that are high blood pressure, so hypertension, high cholesterol, having had a stroke, smoking, all of the things. It is extremely important to reduce those cardiovascular risks that protects your brain as well. The vascular dementia looks a little different from Alzheimer's disease. Alzheimer's disease always involves memory with other cognitive abilities following. Vascular dementia doesn't always involve memory, at least not initially. It often is more reasoning or executive functioning type of, abilities. And Alzheimer's disease is slowly progressive. What we see in vascular dementia is a person might all of a sudden have a decline in cognitive abilities, they plateau, and then there's another vascular event, and there are more cognitive difficulties. So you really want to control those vascular risks.
And I wanted to, I forgot this, Carol, when you were talking about the Dementia Care Coordinator program that you all have at the clinic. There are also programs that the Veterans Affairs also offers to
Right.
veterans. So,
Mhm.
do you want to speak a little bit about those programs? Because I think they do have a caregiver health program as well.
If you are a veteran, veterans actually have a lot of good resources.
Mhm.
And so if you are a vet or have access to those resources, it makes sense to go to them, and they can help you out as well.
Okay. I think there was a question about the card. Um,
Oh, so the
you
lab,
doing if you're out of
the
state?
um, so the if you're out, that the card lab is purely research. That is our research lab, and anyone from anywhere can participate in our studies. And in fact, a lot of the studies are actually online. And one of the things that one of our researchers, Dr. Virginia Gallagher, is working on is looking at younger caregivers. So most of the focus is on caregivers who are spouses, but there are a lot of caregivers who are the children of the person with dementia who have, or even younger grandchildren who are caring for someone with dementia, and they are maybe caring for their own children or still working full time. So there's research on, she's doing research on looking at the impact of where you are in life on your caregiving ability.
Yeah, thank you for that. There was a question about what is the best avenue for advocacy for dementia patients and caregivers. There are so many gaps, and I just want to echo, yes, 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 there is. There are still opportunities for people to contribute. I know if you're in Virginia or anywhere near the university, we have put together several community advisory boards that offer opportunities for community members to kind of help set the agenda for some of the research that we want to pursue at UVA. And there are lots of initiatives that are coming out. So I would say stay close to I think we dropped in some links to the UVA Health as well as our the clinic that Carol runs, because a lot of those resources and opportunities may be listed in the newsletters or on the website for those opportunities to participate and engage. Of course, we always, as researchers, we say that the best way to engage and offer your input too is to be part of clinical trials or to be a part of other research programs. And as Dr. Manning suggested, many of these things are remote. You don't have to actually come to UVA to be a part of them. And so another plug for just being enrolled in the caregiving registry or the registry where we're looking for people who have dementia, people who do not, as well as people who are care partners. And so really that's another way to find ways to engage in this line of research.
There's some questions on virtual and online social engagement. So I have not seen any research on whether or not the benefit is as good as in person, but there are people who can't leave their homes and can't leave their homes either because they don't have transportation or because they are caring for someone with dementia and so I would say that is certainly better than no social interaction at all.
Agreed. I think that flows in line with another comment that says, how do you convince a caregiver to take more time for themselves and engage in various self-care activities? And I would say role model. So if you are going out and you're like, oh, I'm gonna go take a 10-minute walk to, the end of the street and come back. Would you like to go with me? Or it depends on again, the amount of time. And so I always try to encourage people. Again, I'm working with caregivers. If you are caring for someone with dementia, they have very limited bandwidth. So what small kinds of things can you do to increase that activity? It might be a 5 minutes 3 times a day, or starting small is something that I always would encourage. And again, thinking about role model, doing the activities with another person, that peer-to-peer support is always super motivating for folks. Carol, any other suggestions on how to motivate our very time-limited caregivers?
Teaching them to ask ask for help. That is one of the things that our care coordinators focus on is ask for help, because that means our caregivers will be able to get out more. There are a lot of questions here on why there's so much more Alzheimer's or dementia today. And the biggest reason for that is people are living longer. Age is the biggest risk factor for Alzheimer's disease, and the longer you live, the more likely you are to get it. And we're getting much better at keeping people alive and getting rid of other illnesses, so people are living longer.
And I think there are a few questions in the chat around, or in the Q&A around whether or not these slides will be available, and that is yes. And the resources that were also dropped in the chat will also be included, I believe, in that full recording as well. And let's see, we may have time, Carol, if you see one more question, and then we can turn it over to John.
Oh, here's a good question. Family and friends tend to disappear when one member of a couple gets dementia, leading to loneliness, isolation. Any suggestions to combat this? That is a huge problem. So my suggestion, one, support groups are really important. People create friendships with other people, other caregivers. But with the friends who are disappearing, some of it is discomfort at knowing how to interact. And so if you as the caregiver can actually reach out to people and either say, would you be willing to sit with him and you can just watch TV while I go out, or say, it would be really important. I'm feeling kind of lonely. If I can find someone to stay with my husband, could you have dinner? You might have to reach out more, because it is a very common problem that people fall away and they stop asking, and that can be really hard on caregivers.
Yeah. And before I turn it over back to John, I just want to say, I think looking in your particular state, whether it's Virginia or not, for your area agencies on aging, I feel like they're one of the most underused resources, but they are a really good place to start. And I think the link that I've provided for that's in the chat allows you to select, depending on your geographical region, which AAA would be closest to you to actually get started. So again, it's always a pleasure, Carol, to share the stage with you. But I'm going to pause here and thank the audience for hanging with us for this hour. And I'm going to turn it back over to John.
Thank you, Ishan, and thank you everyone who joined us.
Thank you so much to Doctors Williams and Manning for sharing your expertise with our audience today. I am so grateful that your leadership in aging and caregiving touches so many lives. To discover more lifetime learning content, please visit our website at engagement.virginia.edu/learn. Join us next week to learn how to manage your digital life in the well-being algorithm. Thank you again, esteemed faculty, and thank you, audience. I hope you enjoy the rest of your afternoon and evening.